Ladies and gentlemen, please rise to welcome the arrival of Yang Berusaha, Professor Dr. Hasniza Zaman Huri, Deputy Vice Chancellor, Academic and International, accompanied by our distinguished lecturer, Professor Dr. Sasheela Ponnampalavanar from the Department of Medicine, Faculty of Medicine, University Malaya. Thank you. You may take your seats. Selamat datang ke Syarahan Perdana Profesor Dr. Sasheela Ponnampalavanar pada hari yang berbahagia ini. Dengan izin hadirin sekalian, majlis ini akan saya teruskan dalam bahasa Inggeris. Ladies and gentlemen, I would like to extend our warmest welcome to Yang Berusaha, Professor Dr. Hasniza Zaman Huri, Deputy Vice Chancellor, Academic and International, University Malaya. Yang Berusaha, Professor Dr. Sasheela Ponnampalavanar, Professor of Infectious Diseases, Department of Medicine, Faculty of Medicine, University Malaya. Yang Berusaha, Professor Dr. Nazira Hasnan, Director, University Malaya Medical Center. Yang Berusaha, Professor Dr. Abhimanyu Veerakumarasivam, Provost and Deputy Vice Chancellor, Sir Geoffrey Chia Sunway Medical School. Yang berbahagia, Professor Datuk Dr. Yang Faridah Abdul Aziz, Dean, Faculty of Medicine, University Malaya. Yang Berusaha, Technologist Dr. King Yong Jin, Deputy Dean, Faculty of Engineering, Built Environment and IT, Segi University. Management of Faculty of Medicine and University Malaya Medical Centre. Distinguished guests, Professor Sasheela's family and friends, professors, doctors, researchers and fellow colleagues, and all of those joining the inaugural lecture virtually. Welcome to this very special event hosted by the Faculty of Medicine, University Malaya. My name is Anjana Kukreja, and it is my privilege to be the Master of Ceremonies for this lecture, delivered by not only my mentor and teacher, but someone who has profoundly shaped me, both professionally and personally, Professor Dr. Sasheela Sri Ponnampalavanar. A professor's inaugural lecture is one of University Malaya's most cherished traditions. It not only marks the pinnacle of an academic journey, but also celebrates the wisdom and contributions of our professors. Today, we are deeply honored to hear from Professor Sasheela, a professor of infectious diseases in the Department of Medicine, renowned for her leadership in infection prevention and control, and for her tireless work in combating antimicrobial resistance. Her lecture today, entitled "An Ounce of Prevention is Worth a Pound of Cure, Battling Antimicrobial Resistance Together," will highlight how prevention, whether through hand hygiene, stewardship, or sustainable practices, is the cornerstone of saving lives and safeguarding our future. Without further ado, I would like to invite Yang Berusaha, Professor Dr. Hasniza Zaman Huri, Deputy Vice-Chancellor, Academic and International, University Malaya, to chair the session and introduce our esteemed speaker. Please welcome Professor Dr. Hasniza.
It's not working. Oh, okay. Thank you very much, Master of Ceremony. Assalamualaikum and good afternoon, everyone. Yang Berusaha Professor Dr. Sasheela Sri Ponnampalavanar, whom we celebrated today. Professor of Infectious Disease, Department of Medicine, Faculty of Medicine. Yang Berusaha Professor Dr. Nazira Hasnan, Director of University Malaya Medical Centre. Yang Berusaha Professor Abhimanyu Virakumara Siwam, Provost, and also Deputy Vice-Chancellor, Sir Jeffrey Chia Sunway Medical School. Yang Berbahagia Professor Datuk Dr. Yang Farida Abdul Aziz, Dean, Faculty of Medicine, University Malaya. Yang Berusaha Technologist Dr. King Yong Jin, Deputy Dean, Faculty of Engineering, Built and Environment, IT Segi University. Management of Faculty of Medicine and University Malaya Medical Centre. Distinguished guests, professors, doctors, ladies and gentlemen who are joining the inaugural lecture virtually and physically today. Ladies and gentlemen, it is my honor to introduce our distinguished speaker today, Professor Dr. Sasheela Sri Ponnampalavanar, Professor of Infectious Diseases at the Faculty of Medicine, University Malaya, and Consultant Infectious Disease Physician at University Malaya Medical Centre. She is also affiliated with the Centre of Excellence for Research in AIDS, or CHERIA. Professor Sasheela obtained her medical degree from the Manipal Academy of Higher Education in India in 1997. After serving in several Ministry of Health facilities, she began her Masters in Internal Medicine at University Malaya in 2004. Upon completing it in 2008, she joined the Faculty of Medicine and went on subspecialize in infectious disease, where she has since built a remarkable career in patient care, education, and research. Her early work focused on HIV and tropical medicine, and over the years, her attention turned to antimicrobial resistance, infection prevention, and hospital-acquired infections, areas where her leadership has made a profound impact both nationally and internationally. At University Malaya Medical Centre, she spearheaded infection control and antimicrobial stewardship programs initiative that earned the hospital prestigious international awards, including the Asia Pacific Safe Surgery Award in 2018 and the Hand Hygiene Excellence Award in 2022. She has also played a central role in Malaysia's national strategies against antimicrobial resistance and contributed to the country's COVID-19 response efforts. Her expertise is recognized globally. She has served as a WHO temporary advisor, an expert panelist for International Hospital Hygiene Initiative, and is actively involved in local and internal societies related to infectious diseases, including the Society for Healthcare Epidemiology of America, from which she received the International Ambassador Award in 2022. She was also the Fulbright Malaysian Professional Exchange Program, during which she was attached to Johns Hopkins Hospital. Beyond her clinical and research achievement, Professor Sasheela is dedicated to mentorship, education, and also public awareness. She also gives back to the community as a volunteer doctor at the Sushi Free Clinic. Ladies and gentlemen, it is with great pleasure that I now invite Professor Dr. Sasheela to deliver her inaugural lecture entitled An Ounce of Prevention is Worth a Pound of Cure, Battling AMR Together. Professor Sasheela, is yours. Thank you very much.
Just let me get myself together. So this is a sign of old age when you have to put on your glasses and sort yourself out. And that's a sign that you need to do an inaugural lecture. So thank you very much, Professor Hasniza and Dr. Anjana, for that very generous introduction. And thank you, everyone, for being here today, as well as those tuning in online. Over the next 1 hour, I shall share a glimpse of my career journey and lessons learned along the way. As well, but more importantly, I would like to share about antimicrobial resistance and why is it important for us to battle this together. This is also a chance for me to acknowledge my friends, colleagues, and collaborators who have shaped this journey and made this life less a lonely marathon and more a team relay. But before I dive into microbes, resistance, and all the serious stuff, let me begin by sharing a little about myself so that you can understand why I do what I do. My parents, Mr. Varner, I know Srila Sri Ponnampalavanar is very long, but he's known as Mr. Varner, and my mother, Mrs. Leelavati, they are both retired pensioners. My mother is a retired teacher, and my father worked as a hospital dispenser. And my primary education from standard 1 to Form 5 was in Sramban Convent, and I did my Form 6 in St. Paul's. So the nuns, brothers, and teachers who guided us instilled in us that education is not about knowledge, but about character and dedicated service to others. Our motto was, true to our motto, it was simple in virtue and steadfast in duty. After Form 6, I went on to India to do my medical education in the Manipal Academy of Higher Education in Mangalore in 1992. There, I had the privilege of learning from the most brilliant academicians and clinicians who could pinpoint a site of abnormality with nothing more than a very good history and clinical examination, a lesson that taught me the true value of clinical skills till today. After returning to Malaysia, I served in various Ministry of Health hospitals, starting with my housemanship in GH Klang, followed by a rural posting at Klinik Kesihatan Astana Raja and then Tampin. After that, I returned to Sramban Hospital and joined the medical department. Many of y'all may not know this, But actually, my first choice of specialization was emergency medicine, driven by a dream of joining a humanitarian medical organization like Doctors Without Borders. I applied for the Master's of Emergency in USM, and that was the only place that was offering emergency medicine at that time, and I was royally rejected. As they say, everything happens for the best. Then I applied for the Masters of Internal Medicine in and was offered the external program in 2004. This gave me an opportunity to experience postings in different public hospitals and learn from some of the finest and most dedicated clinicians. I owe much of my early growth to mentors like Dato' Tayabaran, Dato' Sri Raman from GH Sramban, as well as Dato' Chiang and the late Dr. Puru from my hematology posting in GHKL. Many thought I was going to do hematology, Prof. Gun, but I went on to do ID. Their humility, depth of knowledge, and unwavering dedication left an indelible mark on my clinical approach and professional values. I graduated in 2008. It was such an honor to receive my scroll from our Chancellor, Sultan Nazrin Shah. And there's lots of memorable moments with my master's course mates, studying and working together to make sure no one was left behind. And in fact, 3 hours from my batch went on to do infectious diseases. After completing my master's in internal medicine, I joined the Faculty of Medicine in in 2008. And it took me quite some time to actually convince my father that I was not leaving public service. I had to tell him I was just going from one ministry to another ministry. So I chose to subspecialize in infectious disease because I loved mysteries. So ID felt like a natural fit because diagnosing infections was often felt like you're solving a whodunit. Like this case that I was referred to, a 46-year-old Malaysian working in Singapore, incidental lung finding during his pre-employment screening, and his only complaint was 6 months of intermittent dry cough, which was actually not bothering him. But just like any ID physician, we went on to take more history, and we had a very colorful history. He worked in a food industry, he loved to travel, especially in Southeast Asia. He went to China, Vietnam, Cambodia, and he loved to eat raw shellfish, oysters, and seawater blood clams. Anyone wants to give an answer? The IDs anyway? Well, it turned out to be paragonimiasis, a rare parasitic lung infection caused by eating undercooked or raw crustaceans. Together with Prof. Rahila and Dr. Amira, the former heads of parasitology, and my dear Anjana, we published this case report. It is true what our teachers told us. The best textbooks are the medicine are our patients. My subspecialty training in infectious disease was most profoundly shaped by Professor Adiba Kamaruzzaman, whose clinical acumen, compassion, and unwavering commitment to public health left a lasting impression on the way I practice medicine. I'm also very fortunate to train under Dr. L.H. Tan and Dr. Noliza Arifin, 2 exceptional ID physicians who enriched my early years. And they left soon after, and it was just me and Sharifa, my partner in crime. So these are photos of the ID team, the nurses in WP1, and the Churia team in the early years. They bring back so much of memories. Sumati is here, and also Teresa and Clara. The beginning of teamwork, growth, and friendship that laid the foundation for everything that we have built since. My initial work focused on HIV, dengue, tropical medicine, like rickettsial disease and malaria, and treating hospital-acquired infection. My heart has always been on tropical medicine, which led me to pursue a certificate in travel health from the International Society of Travel Medicine in 2012, and more recently, a diploma in tropical medicine. One of the landmark studies I was honored to be part of was the randomized controlled trial on dengue, in collaboration with our colleagues from Singapore, led by Professor David Lai from Tan Tock Seng as the principal investigator, alongside an outstanding team of investigators. Dr. Liao Yi-Sin, Professor Paul Tambea, Dr. Sharifa was our lead in University Malaya, Prof. Adiba, and Prof. Lucy. This trial was pivotal in finally putting a rest to the long-standing clinical question, do patients with dengue with thrombocytopenia need platelet transfusion? The results was published in Lancet 2017 and showed that prophylactic platelet transfusion was not superior to supportive care alone to prevent bleeding, and in fact, it may cause some side effects. I want to take this time to actually acknowledge Dr. David Lai, who generously shared his expertise and support when I was starting out my antimicrobial stewardship journey, and Professor Paul Tambeya from NUH, whose mentorship has been a constant source of inspiration. I also would like to thank Prof. Lucy, our true dengue guru, from whom I learned not just the science of dengue, but the art of compassionate cure. This photo captures our ID team with her in our dengue workshop that we recently organized. While my heart was in tropical medicine, unfortunately, we began to see an even more pressing challenge, the rise of multi-drug-resistant organisms and hospital-acquired infection. We increasingly saw patients like this woman admitted with an unrelated condition, but developing a hospital-acquired infection during her stay. This patient had an upper GI bleed, and she needed IV lines for resuscitation, but just 7 days later, she developed a hospital-acquired infection, which was a line-related infection, and her blood grew a very resistant organism that we had no options of any antibiotics to give her. This is not just a global issue. It was becoming increasingly urgent in Malaysia as well as in UMMC. So I had to shift my focus from tropical medicine to tackling antimicrobial resistance and hospital-acquired infections. Now, antimicrobial resistance happens when an organism, which could be a bacteria, virus, fungus, change and become resistant to the antimicrobials, which could be antibiotics, antivirals, or antifungals that used to treat the infections they caused. Now, rapid emergence of antimicrobial resistance is due to overuse and misuse of antibiotics, not only in humans, but in animals and plants. And hospital-acquired infections, these are infections that patients get during care in their hospital, and this could include hospital-acquired pneumonia, surgical site infection, catheter-related bloodstream infections, and urinary tract infections acquired in the hospital. And this usually occurs due to breach in infection control practices, such as not washing hands or not cleaning equipment between patients, as well as not complying to your care bundles. Just a second. Excuse me. So it is estimated that hundreds and millions of people are affected by hospital-acquired infections every year, and no country, no matter how sophisticated, can say that they are free of a hospital-acquired infection. However, hospital-acquired infections are 2 times higher in low middle-income countries like ours compared to high-income countries. And devastatingly, 1/3 of these hospital-acquired infections are caused by multi-drug-resistant organisms. To make matters worse, as resistance increases, the antibiotic pipeline is drying up and making infections harder and sometimes impossible to treat. In many resource-limited countries, including our own region, new antibiotics are often unaffordable, unavailable, or ineffective. The impact of antimicrobial resistance is devastating. By 2050, drug-resistant infections are projected to kill about 39 million people globally, including 20 million in Asia. That's more deaths than cancer and road traffic accidents. The economic toll is also staggering. In Wipro, it's been estimated the annual cost burden is about 20 to 33 billion USD. Antimicrobial resistance is also not just a health issue. By 2030, it is estimated it could push 24 million people into extreme poverty and cut livestock productivity by 7%, worsening hunger and widening inequality, thereby disrupting the core sustainable development goals. So the message is clear. If we fail to act now, the human, developmental, and financial cost is devastating. But all is not doom and gloom. There's evidence that shows that 50 to 70% of hospital-acquired infection and MDRO are preventable. So WHO came up with a global action plan, which was endorsed by the World Health Organization in 2015. And their objective to turn the tide on EMR was awareness and education to improve understanding of antimicrobial resistance, strengthening knowledge through surveillance and research, optimizing antimicrobial use, infection prevention and control, and sustainable investment and innovation. So what did we do in University Malaya? So at University Malaya and in Malaysia, we aligned our strategies to the WHO Global Action Plan, translating the global policy to local action. In this lecture, I will take you through my journey with my fellow AMR busters from UMMC and across the country. I will focus on two main areas, which is antimicrobial stewardship and infection prevention, and I will show how we try to incorporate the Global Action Plan, which was strengthening of surveillance, education, research, and commitment. As I prepared this talk, I reflected on the many hats that we wear as clinician academics. We are doctors, teachers, researchers, administrators, and mentors. The roles may look different, but they all share the same purpose, which is keeping our patients safe and improving their outcomes. So as I share my journey today, I won't be splitting my talk in neat boxes of research, teaching, and mentorship, because in reality, they don't really exist in silos. Instead, I'll attempt to share how we embedded research, mentorship, and collaboration into clinical practice to prevent multi-drug-resistant organism and hospital-acquired infections to improve our patient outcome and strengthen our healthcare system. So I'll start off with antimicrobial stewardship, which just means responsible antimicrobial use. In University Malaya Medical Center, the Antimicrobial Stewardship Committee, Subcommittee, and the Hospital Infection Control Committee was established in April 2014 to meet the requirements of MSQH. Under the leadership of Prof. Patrick, who was then the Timbalan Pengarah Clinical or Deputy Director Clinical, I was appointed the chair of the Antimicrobial Stewardship Committee. And this committee brought together a multidisciplinary team of infectious disease physicians, pharmacists, and clinical microbiologists working together to promote good antimicrobial use in the hospital. And here we have some of the initial members, and some of them are still here. Puan Zhu is here, as Puan Harbans, and our esteemed microbiology team, including Dr. Ruku, Jamal, and Chin Hui, who's our pharmacist, who's leading AMS now. So in my next slides, I'll highlight our AMS work and research to reduce antimicrobial resistance. Our AMS team, the infectious disease physicians and pharmacists, have been instrumental in driving interventions to the ground. On the ground. So these are the photos of my amazing ID team who have grown in number as well as strength. As you saw previously, it was just me, Sharifa, and Prof. Adiba, and we've grown to this really big number now and doing lots of good work. And also, as you can see here, the pharmacy team, which was just 3 of them, Chin Hui, Eunice, and Kain, are a much bigger team now. So at UMMC, the first priority for us was to establish an AMS policy and update our antibiotic guidelines, which had not been reviewed since 2004. A multidisciplinary team representing all specialists and subspecialization from the hospital came together to review these guidelines, and guided by the microbiologist Antibiogram from the Department of Microbiology, we updated our guideline. And since 2014, we have managed to update this guideline every 3 to 4 years, I must say, and we have really been happy about that. And over time, we have also developed clinical pathways, protocols to support clinicians in diagnosing, treatment, and antimicrobial prescribing. At UMMC, as highlighted by the Global Action Plan, effective antimicrobial stewardship depends on a good surveillance tool. But at that time, beyond the basic antibiotic utilization audit, we had no consistent way to monitor antimicrobial prescribing or measure its appropriateness. And that gap is what drove us to the next step. In 2019, I had the privilege of collaborating with Professor Karin Tursky and her team from the National Centre of Antimicrobial Stewardship, or NCAS, in Melbourne, Australia, to implement the Australian National Antimicrobial Prescribing Survey, or NAPS, in UMMC as well as in UKM. This validated web-based tool allowed us to measure the prescribing quality, co-design antimicrobial stewardship interventions, and set clear KPIs. At UMMC, the interventions that we had put in were mandatory AMS training for all doctors and linking our e-prescribing to guidelines. And that significantly increased our guideline compliance as well well as increased the appropriateness of our antibiotic use. But beyond the numbers, the project actually strengthened local capacity and improved stakeholder collaboration. So here are photos of my UKM team, Prof. Patrick, Isa, Chilan, and Adila, who just finished a PhD, and our Australian counterparts in Melbourne. We also, this collaboration led to several publications. Our work on surgical antibiotic use in collaboration with the surgeons began in 2015 with a study by my master's student, Lim Mankit, who I co-supervised with Dr. Pauline, which informed key interventions such as improved documentation, prescriber education, and development of surgical prophylaxis guidelines. And more recently, together with Prof. Dharmendra and his trainee, Dr. Tan, so Prof. Dharmendra is our neurosurgeon, we examined antibiotic prophylaxis in elective neurosurgery in UMMC, showing that while antibiotic choice was generally good, the duration is often prolonged. So together, these studies highlight how close collaboration between surgeons and AMS teams can strengthen acceptance and stewardship principles and improve prescribing practices. Next is with my geriatric team. So this study by Dr. Kejal, our young geriatrician, and now I think is much more senior, who I supervised during her master's, together with Kitman as well as Sharul. She did a study on Staph aureus, multi-drug-resistant Staph aureus bacteremia in older patients. And this study found that the outcome was significantly worse in our older adults, and as reported in other studies, the mortality was associated with inappropriate targeted therapy and lack of ID physician consultation. So these findings actually highlighted that we needed better collaboration between our teams and led to that early referral and better collaboration between the ID and the geriatric team. In 2014, this always brings a smile to me. So in 2014, during my sabbatical at Monash and Alfred Hospital in Melbourne, I had the privilege of working alongside some of the truly inspiring colleagues, such as Ian Woolley, Dennis, as well as Alex Pediglione. My mentor, Alex, down there, down back, at the back of me, showed me not just the science of successful antimicrobial stewardship, but the art of building bridges across disciplines. The successful, that successful stewardship isn't only about protocols and policies, but also about conversation, trust, and as you know, in Melbourne, it's always about coffee and chocolate. So we had a lot of our discussions over coffee and chocolates, and I must say that led to a lot of improvement in the stewardship program. I was also very fortunate to spend time in the hospital in the home team, whose model of patient care inspired me to establish the OPED service in UMMC. And also I made friends for future collaboration, such as Jason Tribbiano, which I'll tell a bit later. So in 2018, we established the outpatient antibiotic therapy to enhance outpatient therapy service in University Malaya, enabling clinically stable patients to complete their intravenous antibiotics in an outpatient setting. The primary aim for this was actually to get our patients out of the hospital as quickly as possible so that they don't develop a hospital-acquired infection and multi-drug-resistant organism. And we surveyed our patients, and many of them actually said they preferred OPED to inpatient therapy, 90% of them. And more importantly, we managed to optimize bed utilization days with 3,864 bed days saved. So I also would like to acknowledge Guajing and Pauline. The three of us actually did all the paperwork during the initial setup of OPED. And now, of course, our OPED service is run by our OPED nurses, as well as our ID physician, who play a very vital role in this. In 2020, we established a penicillin allergy delabeling service in University Malaya Medical Center as part of our AMS program. The initiative began as a quality improvement project led by Dr. Lim Casey, an ID trainee from the Ministry of Health who was doing his attachment in infection control under me. Penicillin allergy delabeling is one of the low-hanging fruits in antimicrobial stewardship because a large number of patients are actually mislabeled as penicillin allergy. And once you're mislabeled as penicillin allergy, you're bound to get a broader spectrum of antibiotic, you have poorer outcomes and increased antimicrobial resistance potential. So in our cohort of patients that we took, since we started our penicillin delabeling services, 30% of our patients were actually delabeled, who were wrongly delabeled, were delabeled actually successfully, and this led to narrower spectrum antibiotic use and lesser potential for antimicrobial resistance. In 2024, we joined the International Network of Antibiotic Allergy, or INAN, a multinational collaboration led by Dr. Jason Tribbiano to evaluate from Austin, Australia, to evaluate the global penicillin allergy delabeling program using a digital tool. So Jason is one of those people I met during my sabbatical in Australia in 2014. So going for sabbaticals is important for networking and finding collaborators. For UMMC, this was not only an opportunity to contribute to a global collaboration, but it also strengthened our local capacity and enhanced actually our clinical services. The other thing we did was, carbapenem AMS. So carbapenems are actually our last line drugs against serious infection, and therefore they must be used wisely to preserve their effectiveness against resistance. In 2018, we launched a multimodal carbapenem stewardship in UMMC, and this included pre-prescription approval form and immediate audit and feedback. In 2021, one of our pharmacists, Sui, she's here today with us, under the guidance of myself and the ID team, developed an online education module. And following this, implementation of this module, we saw an increase in AMS recommendation acceptance, improve in appropriateness of carbapenem use, and decline in overall carbapenem utilization in the hospital, showing cost savings there, and no increase in mortality, indicating that it was safe. Back in 2016, there was no dedicated organization championing antimicrobial stewardship in Malaysia. I had the privilege of being one of the founding members, and the lead was Dr. Suresh, of the MSIDC Antimicrobial Stewardship Interest Group, or MEMSIC. This group brought together experts from the Ministry of Health, universities, and stakeholders from different areas to strengthen stewardship efforts nationwide. One of our key contributions was the development of the Malaysian Antimicrobial Stewardship course, which is online, which is now widely used in hospital orientation programs in UMMC and several other hospitals. And I'm sure if you're from UMMC, you know about it because it's so painful for you to do it. I've got a lot of complaints, but people have also said it is good. So thank you for doing it. Through this platform and ongoing collaboration, we have built capacity, raised awareness, and supported Malaysia's ongoing fight against antimicrobial resistance. I've also contributed to several national guidelines, including the treatment of multi-drug resistant organisms, as well as the antimicrobial stewardship guideline, and reviewed our national antibiotic guideline. The next slides will highlight I will talk on infection prevention and control, and my work actually on it started when I was appointed as the head of the infection control department in 2017. The next slides will highlight my work and research in infection prevention and control, which could not have been possible without, number one, the dedicated and tireless effort of the UMMC infection control nurses and doctors. Thank you, girls. Working with Associate Professor Dr. Cindy Tay from the Department of Medical Microbiology, our complementary strengths and shared vision for safer healthcare has led to impactful research, successful grants, and mentorship of students. So most of the students you see are, I've co-supervised with her. And mostly to Matron Hashima and the nursing team in UMMC who have ensured that IPC strategies are put into practice efficiently every day on the ground. So thank you very much, matrons and nurses who are here. So understanding the epidemiology of MDRO in our hospital is essential to guide targeted intervention. So we conducted a retrospective study on CRE, one of the most deadly antimicrobial resistant organism with limited treatment options. And we found that in our study, the mortality rate was very high at 30%, and it was associated again with older age, prolonged hospital stay, and the use of invasive devices. These findings highlighted that in our hospital, we needed stronger infection prevention measures, including surveillance, contact precaution, catheter care bundles, hand hygiene, as well as staff education. CRE poses, or carbapenem-resistant enterobacteriales, poses a dual challenge. Not only are treatment options limited, but its complex resistant mechanisms make control and containment equally difficult. I'm pleased to share the work carried out by two of our PhD students, Yi King and Mini. Their research showed that carbapenem-producing Klebsiella pneumonia spread more easily between patients thanks to mobile genetic material or plasmids that can jump between bacteria due to poor infection control measures. In contrast, non-carbapenemase-producing organisms are less likely to spread due to the chromosomal mutation and are usually linked with antibiotic use. So these studies show that tracking resistant mechanisms, not just resistant patterns, is essential to guide targeted interventions in our hospital. We also studied other multi-drug resistant organisms such as MRSA, carbapenem-resistant Acinetobacter baumannii, as well as Klebsiella pneumonia to better understand their resistance mechanisms and guide our prevention measures. Our students, Weng Kiong, worked on MRSA biofilm formation, JJ on resistance genes in ICU Acinetobacter, and Kong on the convergence and resistance and virulence in hypermucoviscous Klebsiella pneumonia. I had the privilege of leading my ERIC project, Evaluation and Recommendation of Infection Control in Malaysia, a 4-year TRGS-supported initiative to combat multi-drug resistant organisms and improve ICU outcomes through precision health. This study was conducted among ICUs in UMMC, GHKL, Klang Hospital, as well as Queen Elizabeth II. And this project brought together intensivists, ID physicians, microbiologists, nurses, as well as infection preventionists. So what was nice about this project was it had 4 sub-projects which was led by experts from different fields. Prof. Awang from the Faculty of Arts and Science led the psychosocial and behavioral aspect. Dr. Cindy looked into development of a point-of-care test for carbapenem-resistant organisms. And Associate Professor Yap Xiao Ling worked on a plasma-based sterilization method. And she was from the Department of Physics, Faculty of Science. And my team, the next sub-project, was integrating IPC and EMS strategies to reduce antimicrobial resistance and optimizing ICU outcomes. So we got this grant in the middle of, just before COVID, and then COVID came about. But despite the challenges of the pandemic, we not only managed to establish, collaborations, but also we managed to churn out 11 publications up to now, and we have supported the training of 7 PhD students and 2 master's students. And one of the key outcomes from this project was a multi-center CLEP-C study that was recently published, and this work was led by my PhD student Arul, whom I co-supervised with Prof. Azim from ICU and Dr. Chin Ai from RUCA. And this study revealed a high incidence of CLEP-C rates, which is catheter central line associated bloodstream infection rates, and poor compliance to core elements of the central venous catheter care bundle. And these findings actually informed targeted interventions, whereby we developed an education module and gave audit and rapid audit and feedback. And after the intervention, we saw a significant decrease in CLEP-C rates by 37%, increase in compliance by 20%, and significant improvement in knowledge, attitude, and perception of the healthcare workers in this ICU. Another very impactful project that we did in UMMC, that we did with our nurses and was led by our radiology team, Ms. Chandriga and Prof. Anusha, focused on reducing CLEP-C in PICC patients. These are patients who have a peripherally inserted central catheter. Using the Johns Hopkins CUSP framework, the team implemented safety rounds and the reinforced CLEPSI bundle and garnered leadership engagement. And this resulted in a 33% reduction in PIC-related infections in our hospital. Another very important study that we did was the initiative known as the Prevention Infection in Neonates, or the PIN Collaborative, and this was a partnership between Johns Hopkins and the UMMC Pediatric and Infection Control Departments. This project aimed at decreasing hospital-acquired bloodstream infections in NICU by strengthening bundles such as hand hygiene, central venous catheter care, and environmental cleaning practice. And over 26 months, we saw a 50% or 56% reduction in hospital-acquired bloodstream infection among our little babies. And also there was more than 90% compliance to the bundle care and more than 90% in some of the areas. So this project not only built capacity, but I think it also showed that it's very possible for a low resource, country, I would say, to make a change and reduce infections. And I'd like to thank Ibu Kun and Aaron and Melanie from Johns Hopkins for being with us and helping us implement this project. Another very important area is surgical site infection, and this is a global problem. Yet up to 60% of these surgical site infections are preventable with evidence-based guidelines. And I'm very, very fortunate, I must say very fortunate, because I work with incredible surgeons who are deeply committed to prevention. Prof. Azlina, Dharmendra, Vairavan, the whole team. In fact, they come up to the antimicrobial stewardship team and the infection control team and collaborate with us and ask us what needs to be done. So thank you very much, guys. You really, really make my life easy. So, together with the surgeons, nurses, anesthetists, we implemented an SSI prevention bundle using the WHO multi-model strategy, which focused on capacity building, education, audits with feedback, communication, and shared accountability. And this led to a staggering and significant reduction in our SSI rates, more than 50% across all procedures that we were monitoring: ORIF, mastectomy, craniotomy, CABG, as well as LSCS. So thank you, everyone. Just as important was capacity building. We actively engaged junior doctors and nurses to audit into audits, train them in quality improvement project, empowering them to take ownership of patient safety. And our work has been shared on international platforms such as in the EPSIC conference and ICPIC in Geneva. In recognition of our hospital receiving, our hospital's work in surgical site infection, in recognition of it, our hospital actually received the Asia Pacific Society Infection Control Safe Surgery Award in 2018. So this is a photo of me and Azlina during the as COVID was going down, and we got a letter saying we got this award, and Azlina got the cake, and I got the curry puffs, and we followed SOP, and we had a party. Everyone packed their food and took it back, but we really needed to boost our morale at that time. And Azlina, it was with Azlina that I started this SISI project. We started with ORIF, and then we rolled it out to all the other procedures. So thanks, Azlina. I also want to take this opportunity to thank Dr. Ling Moi Ling, former EPSIC president and IPC expert from Singapore GH, who first introduced our team to this SSI Quality Improvement Project, and for her mentorship. So SSI prevention not only saves lives, but it also saves money. So our SSI prevention bundle that I told you about earlier has significantly improved outcomes in our surgical patients. So in CABG, the infection was reduced by 76% with cost savings of over 270,000 ringgit. And this work will be shared by Sister Shuhada at the ICPIC in Geneva next week. And this is another very proud moment for us, for one of our own nurses going to Geneva to give an oral presentation. I think, I don't know whether anyone else has done that before, and Infection Control Department has. Thank you. Similarly, in breast surgery, Dr. Sindhu's master's project, co-supervised with Prof. Aisha, showed a 70% reduction in SSI and substantial cost saving. And this publication was recently, and this paper was recently accepted for publication in the World Journal Surgery. So thank you, Suniza, for leading it. And both these studies actually highlight the impact of multidisciplinary teamwork. The other study I want to talk about is by our PhD student Anis, who conducted a prospective SSI study which included patients from orthopedic, neurosurgery, as well as general surgery. And it showed that almost half of the patients who had an SSI, it was a multi-drug resistant organism. And it also identified some modifiable risk factors. And with these findings, we were able to discuss with the surgeon in directly changed practices and help surgical team to prioritize early interventions in trauma cases and adapt strategies to reduce multi-drug resistant organism-related SSI. And this study was actually supported and funded by the US NAMRU Indo-Pacific. The other area that we looked into was catheter-associated urinary tract infection, and this is another quite devastating hospital-acquired infection. It is costly, it leads to poorer outcome, and it's actually preventable. So I co-supervised two master's projects on CAUTI prevention. The first was IV, and I co-supervised her with Dr. Vimala from nursing. And we found practice gaps despite good knowledge and attitude, showing that there was a need for targeted training. And the second was by Dr. Angeline Yap. She was an ED physician doing her training here, and I co-supervised her with Izwan and Prof. Izwan and Maria. And we evaluated a multifaceted CAUTI prevention bundle, which reduced unnecessary CAUTI, but more importantly, it reduced the rates of catheter-associated urinary tract infection from 17 to 7 per 1,000 device days. Another thing, innovation is another priority for WHO Global Action Plan on antimicrobial resistance. An example of our work is using an eye tracking technology to improve hand hygiene training in UM and UPM, led by my PhD student, Mini, co-supervised with Prof. Cindy and Dr. Unaiza from the Department of Artificial Intelligence. So unlike traditional audits, eye tracking gives more accurate insights on certain points, such as it revealed a shorter than recommended hand rub time and linking gaze patterns to compliance. These findings offer a new approach to strengthening hand hygiene compliance and highlight opportunities for further research. We were very honored to be invited by Professor David Patterson and Dr. Moin from NUH to join the Econ High Surveillance Network, an initiative tracking hospital-acquired infection and antimicrobial resistance in low and middle-income countries. The platform provided a standardized tool, harmonized protocols, and real-time dashboard to monitor trends and evaluate the interventions that we put in. And being part of this network actually strengthened our data quality, enabled benchmarking, and supports more targeted IPC interventions to reduce hospital-acquired infection. The other thing I want to touch on is hospital environment. This is a very important reservoir for multi-drug resistant organisms, and because MDROs can survive on surfaces for very, very long periods. Studies have shown that patients admitted to beds that were previously occupied by an MDRO carrier faces a higher risk of infection, highlighting the importance of environmental hygiene. So I often say to my family, to my friends, and to my patients, don't ask for a first-class bed, don't ask for a one-bedded room. The more important question is ask, who slept in this bed before me, before you? So remember that, some points to take back home. So we contributed to a review on hospital environment and multi-drug resistant transmission led by colleagues from Singapore and adjunct professor Dr. Kalisva Marimutu, inviting our team from University Malaya to contribute. The review highlighted that sinks, drains, dry surfaces, and equipments are sources of multi-drug resistant organisms and stressed the importance of strong environmental cleaning. A special thanks to Dr. Khalis, who's not only a leading IPC expert in Singapore, but also a very good friend and my go-to person for IPC advice, whose guidance has been invaluable. Thank you, Khalis, if you're signed in. I was very honored. I was also very honored, along with our junior physicians, Azali and RX, to be invited to contribute to a chapter on principles of infectious disease, transmission, diagnosis, and prevention and control in the International Encyclopedia of Public Health, the 3rd edition that was published this year. We were invited by Dr. Giri, our colleague from Queen Elizabeth II, and a section editor of the Epidemiology of Diseases. So now, I'll talk a bit about hospital outbreaks. So, hospital outbreaks are not only caused by communicable diseases like TB, but it's also caused by, and also emerging diseases like COVID. We all know COVID caused outbreak, but it's also caused by multi-drug resistant organisms. An IPC team, or the Infection Prevention Control Team, plays one of the central roles in hospital outbreak management, starting with early detection and rapid response. Effective control, and effective control requires a collaboration across disciplines. So we always include microbiologists, nursing, cleaning services, OSH, JKA, and even the hospital management. And the IPC team coordinates these efforts, implements and evaluates control measures, and provides staff education. And once an outbreak has been contained, the IPC actually conduct reviews to identify lessons learned and strengthen preparedness for future outbreaks. So in recognition of this, the critical importance of AMR outbreak management, WHO Western Pacific Regional Office actually released a practical guideline in 2022 to support healthcare facilities, especially in low-middle income countries, to put in our response. With WHO support, Ministry of Health organized a national Train the Trainers workshop on antimicrobial resistant outbreak, where I served as one of the facilitators. We later adapted the program to Malaysian's context and rolled out a regional workshop across the country to strengthen Malaysian-level AMR outbreak response. In UMMC, unfortunately, we have faced our share of MDRO outbreaks from carbapenem-resistant Acinetobacter, excuse me, from carbapenem-resistant Acinetobacter in our NICU and ICU, to the ones linked to contaminated gels. Each one was actually swiftly contained through coordinated multidisciplinary response by all our teams, which in turn actually strengthened our prevention strategies. So how can we talk about pandemics and outbreaks without talking about COVID? The IPC team worked very closely with colleagues across the hospital to manage and prevent outbreaks. Our COVID-19 research was highly collaborative, bringing together ID physicians, microbiologists, and social preventive medicine, and mainly driven by Prof. Jamal, Prof. Sanjay, Mas, and their students. And we published quite a number of papers looking into outbreak clusters, strengthening our healthcare workers' care and operations and such. One of the things, during COVID, during the COVID-19, I was actually part of the national committee to draft the National Infection Control Guideline, and I was assigned the section on ventilation, assigned the section on ventilation, okay? So there's nowhere in our ID or internal medicine we were trained in ventilation at all, a topic that I knew very little about. So I quickly had to learn natural versus mechanical ventilation, ACH, for those of you who do not know, it's air change per hour, pressure differentials, and so on. But by the end, I had a new skill, identifying safe zones in a room by just reading the ceiling layouts, okay? So I know where the exit and the inlets are. Okay. So this knowledge was not only useful for protecting our healthcare workers and patients in the ward, but even for choosing where to sit in a crowded restaurant. So when I go in, I know which table to choose, okay? So follow me. I could not have done this without 3 amazing engineers, and they just worked behind the scene. So, and I must thank Abi for introducing them to me. So first is Associate Professor Dr. Bernard Saw. He's not here today, and he is from Utah. The other one is Dr. King. He's with us here today. Thank you very much. And he's the president of ASHRAE, the Malaysian chapter. I really couldn't have done it without y'all. And finally, Ponnampalavanar. He's a chemical engineer and also my brother. So, who endured many, many late night calls, patiently explaining to me air movement dynamics and engineering calculation. I'm also very grateful to the Engineering Service Division of the Ministry of Health for reviewing our draft and endorsing the final guideline. So another problem during COVID is, and I think many of you would have experienced it, is the portable air purifiers. It became very popular, with many donated to our hospitals. But how useful were they actually in a room that already had proper ventilation? So together with, again, Bernard from Utah and colleagues from molecular medicine, we tested some of these air purifiers in our own COVID rooms. And the results were clear. In a well-ventilated room, where the air exchange was actually very good, the viral RNA was already very low, and the portable units actually had little benefit. But the key lessons we learned was good ventilation, masking, and vaccination. Don't believe everything you say, vaccination, vaccination, vaccination. I know there are a lot of talks about anti-vaccine. Please don't go towards that direction. Vaccination remained the most effective strategy. Air purifiers may still help as an adjunct in poorly ventilated spaces, but they are never a substitute. So also during COVID-19 pandemic, like many colleagues and fellow advocates of science, I actively raised awareness and shared evidence based on information on transmission, infection prevention and control, and vaccination, reaching both healthcare workers and the public, mainly through webinars. In fact, my cousin Abi, who's a genetic professor from Sunway, and I actually had a webinar with AirAsia, telling them about, vaccination. No, there was no vaccination. I suppose ventilation on vaccination as well. Oh yeah, very interesting questions on vaccination. If you could collect all those questions on vaccination and make a book, I'm sure it would be a bestseller. So during the height of COVID-19 crisis, I was also very honored to be appointed to the Greater Klang Valley Special Task Force for CAC and home monitoring, tasked with strengthening COVID-19 assessment center operations and patient safety in home monitoring. It was a period of immense pressure, but working with colleagues from so many different areas, family medicine, our Ruka, Prof. Adina was with me, I'm not sure whether she's here today, ID and public health, reminded me that teamwork and resilience are the true backbone of public health. COVID-19 also demanded sacrifice from every frontliner, long hours, isolation from families, and constant weight and responsibility. But for many women, this was compounded by balancing duties at work and home. I was honored to share these stories with the Stars Mother's Day feature highlighting not just the struggles, but the resilience, teamwork, and strength that carried us through as women. We should know, we formed our women's group during COVID just to stay sane. Sorry, excuse me. Right. So the next thing is I just want to highlight on is that, a lesser-known consequence of COVID-19, as noted by WHO and CDC, was the rise of multi-drug-resistant organism and hospital-acquired infection during this period. The pandemic strained health systems and worsened antimicrobial resistance through disrupted IPC practices, antibiotic misuse, as well as delayed surveillance. These trends were seen globally and in our own hospital. Our retrospective study showed that during the pandemic peak, hospital-acquired infection, Staphylococcus aureus bacteremia, rose by 42%, with 31% mortality rate due to disrupted IPC practices. But it also showed that the rates decreased significantly by 55% after COVID, once we initiated re-education, retraining, and renewed awareness. This reinforces WHO's call for AMR to be a center of future pandemic preparedness. So it's very important that AMR is put everywhere. Education is the cornerstone of the global and national action plan on antimicrobial resistance, and to support this, WHO has developed several reference documents and to guide countries in strengthening education and training. In University Malaya, with our Merdu team, Prof. Jamuna Wehan, who have been really very helpful in working closely with the ID and IPC team, we have actually integrated AMR education across multiple levels through dedicated undergraduate sessions, master's student orientation, and online modules. These have complemented by lectures and hands-on training to ensure knowledge and is reinforced with practical sessions. In May 2025 this year, I had the privilege of supervising the AMR Awareness Carnival, Pills to Art, led by inspiring student teams from University Malaya, both from the Faculty of Science and the Faculty of Medicine. And through this awareness program, they aim to raise awareness on antimicrobial resistance and sustainability through interactive exhibits and outreach. It was really good to see booths from Ministry of Health, Pharmacy Division, Food Safety and Quality Division, Institute of Medical Research, as well as Maihun. And I have a short public service message for all of you. Never throw unused or expired medicine in a trash or flush them down the drain. Improper disposal can contaminate the environment and fuel antimicrobial resistance. Use designated collecting points and I've got the link up there. It's My MediSafe by Pharmacy Division MOH. I promised them I will tell anyone during my talks that this is where you need to dispose your medication. Do not give your pets, do not throw it to your plants. Just go and throw it in these designated areas. Thank you. So I'm going to talk about some of my awards and achievements, and I'll be showing some photos. And these are photos that I've taken, during my travels, some at home, some overseas. And I've got a story behind this, and I hope you will enjoy these photos as I show them. So I was honored to receive the Fulbright Malaysia Professional Exchange Program hosted by the Department of Hospital Epidemiology and Infection Control in Johns Hopkins, USA, where I had hands-on experience in implementing IPC interventions through the Comprehensive Unit-Based Safety Program, or CUSP, and completed the Armstrong Institute Patient Safety Certificate. Beyond professional aspect, Fulbright anyway is actually a cultural exchange. I had an opportunity to share about Malaysia. I introduced our culture and also gave them a talk about Nipah. After all, Nipah is a homegrown virus, as well as it was actually identified by scientists from University Malaya. So I want to give a special thanks to Prof. Ain for introducing, she's not here today, but from ENT for introducing me to this program, and Melanie Curlers from Johns Hopkins for generously hosting and guiding me through my time there. Sorry, one second. In 2021, our hospital received the Asia Pacific Hand Hygiene Excellence Award, as Prof. Hasniza has said, from APSIC and the WHO Collaborating Center of Patient Safety in Hong Kong and S-Club Academy. This recognition reflects our hospital's commitment to embedding hand hygiene into daily practice and shows how collective efforts in IPC can really make a difference. I also had a privilege of contributing to National AMR Initiative through Ministry of Health committees, technical working groups, and task force. So the first one is, soon after the World Health Assembly endorsed the Global Action Plan on Antimicrobial Resistance, Malaysia began developing its national action plan, and I was really honored to contribute at the first stakeholder meeting in 2016, highlighting the role of universities in combating antimicrobial resistance. This One Health collaboration led to the formation of the National Antimicrobial Resistance Committee, or NARC, co-chaired by the Director General of Health and Director General of Veterinary Service. I have served on this committee and its technical working group since its inception, contributing to the Malaysian Action Plan, Edition 1 and Edition 2. In 2020, I was appointed to the National Technical Working Group for SSI with Prof. Aslina, and together we all developed the Surgical Site Infection Prevention and Surveillance Guideline in 2023. And more recently, in 2024, I was appointed to the Task Force on Decontamination and Reprocessing of Medical Devices, which focuses on developing guidelines and standardizing practices to clean up our equipments to reduce the risk of MDRO transmission from contaminated equipment. So this is a very serious cause of outbreaks, of equipment that is not clean, such as your scopes or your intubation set, especially, and it's happened in overseas as well in our own country. So aligned with the National and Global Action Plan, efforts have been made to strengthen AMR education at the national level. I was honored to moderate a session on integrating AMR in undergraduate medical curricula at a multitask meeting on AMR in human health, organized by the Ministry of Health and supported by WHO. And Prof. Jamuna was there to give her insights. Thank you, Prof. And we are working on now a coordinated curriculum for all universities in Malaysia. The other thing that we did was actually, one second. Okay, I was also appointed by Ministry of Health to develop the National IPCE module to support staff. So actually this module is in Bahasa Melayu, and its photo-based course makes IPC training more practical and accessible for our support staff who are usually missed out when we have all our modules in English. So I was also honored to serve as an advisory board of the Infusion Nurse Society Malaysia, and I had the privilege to contribute as a reviewer to their new guidelines on short peripheral catheter, a very important resource to strengthen clinical practice and reduce peripheral line-related infections. I'm also honored to serve as an expert panel member with the Clean Hospitals, which is an international organization dedicated to advancing healthcare, environment, hygiene, to collaboration, research, and innovation. And one of the important key tools is a healthcare, environment, hygiene assessment framework, which helps facilities assess, track, and strengthen their environmental hygiene programs. So together with Dr. Pam and some of our colleagues from Malaysia, we translated this tool into Malay, ensuring that it is accessible and applicable for local healthcare setting and strengthen hospital environment hygiene practices nationwide. So leading on to this, I was honored to serve as a trainer and speaker at the first Healthcare Environment Hygiene Train the Trainers Network meeting, which was organized by Clean Hospitals and University Hospital Geneva and supported by the Ministry of Health Malaysia. I also had the privilege, after we won the Hand Hygiene Excellence Award, I had the privilege of serving now as an expert panel member of the Asian APSIC Hand Hygiene Excellence Award panel in 2023, and I had the privilege of reviewing outstanding initiatives from hospitals across the region, including Philippines, Thailand, and Indonesia. And I was very honored to serve alongside IPC giants, actually, like Professor Didi Pite, Professor Wing Sito, as well as Ms. Patricia, while learning from their vast experience. In 2019, I had the honor of serving as a WHO temporary advisor during the regional consultation on AMR held in Cairo. It was a privilege to contribute to discussions on strengthening surveillance and infection prevention strategies in low-middle income countries. Now, the overuse and misuse of antibiotics by the public is a key driver of antimicrobial resistance. So to better understand the factors influencing inappropriate use, we conducted 2 KAP studies and developed questionnaires on antimicrobial resistance. The first was funded by WHO, and in collaboration with Ministry of Health, that's Dr. Suraya, Dr. Ben Zawania, as well as Professor Wong Lee Peng and a team from the SPM department. And the second study was carried out by our PhD student Vedika, with a support from a PAR Foundation grant. And this study showed that over 90% of respondents had taken an antibiotic, and nearly 30% of our public used them for fever and flu, conditions that actually don't need an antibiotic. And knowledge was better among those aged between 30 to 49, have a higher income, better education, and are from the suburbs. These findings help guide national intervention strategies to improve antibiotic use. Also, since 2015, when the first Antibiotic Awareness Week was launched, we have had this campaign yearly in our hospital, and in conjunction with World and National Antimicrobial Resistance Week, engaging students, healthcare workers, the public, and policy. So that's all of us at the first AAW meeting in 2015, everyone looking very young, and some of with our nurses. And these are actually medical students. You won't see medical students like that anymore because they wear scrubs. So this is a very old picture. Beyond institutional campaigns, I've also worked to raise awareness through public media, appearing on BFM Radio's Doctor in the House. This is a picture of me with Dr. George Lee, for those of you who listen to BFM. Also at TV1, Selamat Pagi Malaysia, and interviews in various newspapers. To strengthen our AMR efforts, our team in UMMC, we formed a group called AMR WISE, a multidisciplinary group bringing together experts from different fields to drive research, policy, and public engagement. So you can scan the QR code if you want to know more about this group. To make AMR conversations more accessible, we launched the AMR Talk, a podcast supported by PAR Foundation. And each episode explores a different aspect of AMR with global as well as local experts. For example, Prof. Anton Pelag talked about AI and AMR. Professor David Patterson spoke about regional collaboration as well as clinical trials in the region. We are especially grateful to Mira Sivasodi, formerly BFM and now an adjunct professor in Monash. Congrats, Mira. For guiding us on the media communication strategies. And for full disclosure, it's not that easy to get Mira, but she's one of my closest friends from convent school. So facts alone may not move people, but stories can. We published the AMR Diary, a project by our student Vedika, giving voice to our patients and caregivers who have been impacted with drug-resistant infections. It reminds us that behind every resistant organism, a human story, and those stories are powerful tools to fight AMR, which we will play this video for you later. So now, before I go on to acknowledgement, I just wanted to say a few words on something that I am passionate about, and it's also linked to antimicrobial resistance. There is now clear evidence that climate change and pollution are linked to antimicrobial resistance and emerging diseases. So protecting our environment is not just about conservation, it's about protecting our health. I've been very fortunate to climb some of the most beautiful peaks, starting with Mount Kinabalu in 2004, and then Everest Base Camp, Annapurna Base Camp, Mount Blanc, and some of our beautiful local hills with amazing friends and family. Shah, can you see yourself there in Mount Blanc? I hope these photos and the ones that I've showed you throughout this presentation will inspire you to cherish what we have and preserve this precious gift. And I think that is really important that we preserve our environment. No more cutting trees and building new buildings. We don't need another mall. We really don't need another mall. Okay, now I'll go on to acknowledgements. I would like to take this opportunity to express my deepest gratitude to the top management of UM, the deans and deputy deans, the Faculty of Medicine, the directors and deputy directors of UMMC, as well as the heads of department from all the departments in UM, as well as UMMC, clinical and non-clinical. And of course, I put up the photos of my own bosses from the medical department. Your unwavering support for your unwavering support for our antimicrobial resistant initiative and your commitment to prioritizing patient safety have been instrumental in driving our work forward. From ensuring resources and policies are in place to championing these efforts at the highest level, your leadership has created an environment where innovation and collaboration can strive. I must also acknowledge with gratitude Prof. Sanjeev, all right, who has... Prof. Sanjeev, who was assigned to me as my mentor when I first joined UM in 2004, and who has continued to guide and support and encourage me throughout my career, now as a friend and colleague. Thank you, Sanjeev. Thank you very much. To the past and present administrative staff of the Department of Medicine, Lisa, I didn't have the recent photos, so sorry. Thank you for your assistance, efficiency, patience, and constant support in managing our requests and keeping us on track. Thank you very much. And before I forget, I also want to thank Vicom for today's session because they've done really great work to make sure I submitted everything on time. To my fellow AMR busters from MOH, I hope some of you are listening in. It has always been a pleasure working with you as we toil over countless guidelines, protocols, and workshops. Dato' Suresh, Dato' Lee, Chow, Farah, Anila, Kerr, Mas, and the list goes on. And here at UM is our UM AMR busters, our infectious disease team, pharmacists, infection control team, with Dr. Saleh representing hospital management, and my students and research team. These are the incredible people who work tirelessly behind the scene to actually keep our hospitals safe. I'm very grateful for friends who have been by my side through my ups and downs, offering support, encouragement, and laughter along the way. So, our ZFG group is there, who we started during COVID-19 to keep sane, and this is the group I go to get advice on design, fashion, gardening, and everything else under the sun. Lillian, Vijayan, and Shobana, thank you for being there from our school days. My sisters from another parents, Mei Peng, she has always been there with me. Ritu, Masliza, CB, my dear cousins, Anita and Kanda, Shushina, and many more, Clara, and my partner in crime, Sharifa. Thank you, all of you, and the list goes on. There's not enough place to put everyone here. And finally, actually, above all, I want to thank my Papa and Amma. Your love, sacrifice, and values have shaped the person I am today. I'm forever grateful. And I hope I've made you proud of this. To my beloved siblings, Vanita, Bhavani, and Balan, thank you for the unbreakable bond we share, a constant source of strength and joy. To my in-laws and to my nephews and niece, you bring color and laughter to my life. To my parents-in-law, the late Mr. Parameswaran and Dr. Vijayalakshmi. My mother-in-law is a retired radiologist, and the radiologists here would probably know her. Thank you for your kindness, understanding, and support. And of course, sorry, I didn't put up the photo. That's my mother-in-law and actually my whole family, my nephew, nieces. I've only got one niece. We are a boy-centric family, unfortunately. And of course, to my husband, Vijay Ananda, my sons, Ishan and Trishulan, and my furry kids, Griffin and Scruffy. Your unconditional love and the joy you bring to my life has made this journey possible. There's also a saying in Sanskrit, and the saying goes, Mata, Pita, Guru, Devam, which means mother, father, and God in that order of reference. I've paid my respect to my mother, father, and to my teachers and mentors. And finally, I thank God for blessing me with all these amazing people in my life and guiding me through this journey. And just like any lecturer should do, it's very important that I give my final thoughts, okay? So to all my ID colleagues, IPC, those who want to do antimicrobial stewardship, Just to let you know that there will always be challenges. Just keep going. Setbacks are inevitable. Resistant bugs will continue to evolve. Resources will always be limited, and progress can feel painfully slow. Many times I felt like Sisyphus, pushing the same boulder uphill only to see it roll back down. But better results don't come from repeating the same action and expecting changes. What matters is our ability to adapt, shift, strategize, and explore new approaches. With teamwork, but most importantly, we need friends and like-minded colleagues to push along us. That's my team, all right? With teamwork, even the heaviest boulder can be moved further than any one of us could manage alone. As Theodore Roosevelt said, the most important single ingredient in a formula of success is knowing how to get along with people. The next thing is to my students out there, treat your patients as you would treat your parents. So, when I started my posting in GHKL and my father gave me my first stethoscope, he told me, treat every patient as if you're treating me. And I've held to this principle, and this principle has guided me through my career. I wish he had said, go private and make more money, but unfortunately he told me this, so here I am today. My thoughts on our KPI. Infection prevention and stewardship are never the work of one person or even one department. To succeed, every member of a multidisciplinary team plays a very vital role. Yet too often our KPIs focus only on individual achievements, may it be grants or publications or citations. What we really need are metrics that can recognize teamwork, cross-disciplinary collaboration, and shared responsibility, because AMR and IPC it truly takes a village to make a lasting change. To mentors out there, be broad shoulders that others can stand on. I've been very fortunate to stand on shoulders of giants, mentors who have given me their time, their wisdom, and their encouragement. Our duty now is to be those broad shoulders for the next generation so that they can see further and go farther. I would like to end my talk with a quote that I have carried with me since I began lecturing on AMR in 2013. It comes from my idol, Professor Dame Sally Davies, the former Chief Medical Officer of UK, whom I had a privilege of meeting in one of the international conferences. And she described antimicrobial resistance as a catastrophic threat. She said, unless resistance is curbed, we will find ourselves in a health system not dissimilar to the early 19th century, where organ transplants, cancer, chemotherapy, joint replacement, and even minor surgeries will become life-threatening. And we are seeing that today. So this is my last slide. As Benjamin Franklin wisely said, an ounce of prevention is worth a pound of cure. In the era of antimicrobial resistance, an ounce of prevention is just not good practice. It is our only powerful defense. But this will only work when we take action together, clinicians, researchers, nurses, engineers, patients, policymakers, as well as public. I hope with my lecture today, I have shown you that hospital-acquired infection and AMR is a global threat, but it can be reduced even in a resource-limited setting like ours. So let's make healthcare safer today, together. Thank you. Before I end, I would like to play our AMR video. It's a video that, it's a video about our patients and caregivers who have undergone or were impacted with antimicrobial resistance. What do we need to do?
It's quite long for me already because my husband's admitted about 1 year. I have a lot of resistance for almost major antibiotic already. Yeah.
He had this Sasheela pneumonia, the same bugs infection, and you can see that the trend actually is getting more to the resistant strain. Even though I'm a medical doctor, but seeing your son actually in NICU and then had apnea in front of you is a very traumatized incident.
Before, I'm so happy I can drive car, I can go out, I enjoy, I have a lot of friends. Now I lost everything.
Maybe about a week postpartum, I felt pain over my episiotomy wound. After a few days, the pain came back again, and my wound broke down for the third time. And at that time, the tissue culture came back as CSL, fat cell, heavy growth. It was a physically and emotionally painful experience for me.
Thank you very much, Professor Sasheela, for your truly inspiring and thought-provoking lecture. Ladies and gentlemen, I would now like to invite Yang Berusaha, Professor Dr. Hasniza Zamanhuri, back to the podium to summarize and conclude today's inaugural lecture.
Amazing work, Prof. Sasheela. Once again, huge congratulations to Prof. Sasheela. Well done. I have to put my spec on as well, due to aging. Okay, ladies and gentlemen, we have just witnessed an inspiring and eye-opening inaugural lecture by Professor Dr. Sasheela Sri Ponnampalavanar, entitled An Ounce of Prevention is Worth a Pound of Cure, Battling AMR Together. Professor Sasheela has reminded us that antimicrobial resistance and hospital-acquired infections are not distant threats, but real and urgent challenges affecting life, healthcare system, and the future of medicine, especially in our region. Her lecture today has shown us that while the fight against AMR is difficult, it is not impossible. With prevention, stewardship, innovation, and above all, collaboration, we can overcome this challenge. Her journey from HIV and tropical medicine to infection prevention and antimicrobial stewardship is a powerful example of dedication, resilience, and leadership. She has highlighted how success depends not on one person or one discipline alone, but on the collective commitment of healthcare professionals, policymakers, researchers, educators, patients, and communities working hand in hand. On behalf of the Faculty of Medicine and University Malaya, I wish to thank Professor Sasheela for sharing her wisdom, her passion, and her vision with us today. Her message is not only a scientific call to action, but also a human one, reminding us that in medicine, prevention truly is better than cure, and that together we can safeguard the health of future generations. Ladies and gentlemen, please join me once again in congratulating and thanking Professor Dr. Sasheela for her outstanding inaugural lecture. Once again, well done, Professor Sasheela.
Thank you, Professor Dr. Hasniza, for chairing this lecture today, and thank you once again, Professor Sasheela, for your impactful and memorable sharing. Antimicrobial resistance is often called a silent pandemic, but through your work today and today's lecture, you have reminded us that small, consistent actions carry extraordinary power. Just to share with everyone, today's door gift reflects Prof. Sasheela's philosophy. Hand rub chosen as a symbol of hand hygiene, and a card with seed paper with coriander seeds chosen for their antimicrobial properties. A sustainable reminder that prevention is truly in our hands. And so let us end with these lines. Prevention first before harm takes hold. Clean hands protect both young and old. Through wise action, health we secure. Together we build a future more sure. Ladies and gentlemen, this concludes our event for today. Thank you very much for sharing this momentous day with Professor Sasheela. To commemorate today's event, photography sessions will commence now. I would first like to invite Professor Dr. Hasniza and our celebrated Professor Sasheela on stage for the first photograph. And now, we would like to have a group photo with all of us present here today, and I'd like everyone to get into the middle of the hall. Oh, could I also request everybody to please stand up for the picture and come together? Yep. Could I just get everyone to come in? Okay, and I'm going to jump in as well.
Okay, everybody look here. Get this camera. Okay, ready? 1, 2, 3. Right. Freestyle, ready? 1, 2, 3. 1, 2, 3. Right, thank you.
On behalf of the Faculty of Medicine, University Malaya, thank you once again for being a part of this memorable afternoon. Please do enjoy the afternoon tea at Center Point. Stay safe and take care. We'll now move on to the photograph sessions. I'd like to invite Dr. Sasheela's family members to come, followed by the Department of Medicine and Infectious Disease team. Sorry.